Welcome back to Better Kansas City. Pelvic pain is one of the leading complaints women have, but for a variety of reasons, women often suffer in silence. Dr. Rachel Hailey from HCA Midwest explains the causes and how they could signal a chronic issue. So Dr. Hailey, we know that women are their family's CEO of healthcare, but sometimes they will put their own healthcare needs on the back burner. When it comes to pelvic pain, why is that?
Well, women aren't just the healthcare CEOs. They take care of everybody else. They're working, they're managing their home, they're taking care of the kids, and everybody else's healthcare comes before their own.
So let's talk about what could be going on with a woman's body when she's experiencing pain.
Well, a lot of women suffer from pelvic pain needlessly. There can be many underlying causes that aren't just your simple menstrual cramps. I think it's important to differentiate that there are acute causes for pelvic pain and chronic causes. The acute ones can be simple as a urinary tract infection or irritable bowel syndrome, also an appendicitis or a ruptured ovarian cyst. But there are other conditions that can lead to more chronic pelvic pain. Some of those include things like endometriosis, adenomyosis, or uterine fibroids, and these occur when the uterine cells either grow abnormally or in abnormal places, and this can lead to prolonged bleeding, pain before or during intercourse. The other causes could be interstitial cystitis, which is a chronic inflammation of the bladder that can occur in women in their 30s and 40s. Also ovarian cancer and pelvic inflammatory disease, which is an infection of the female organs, can happen and cause chronic pelvic pain.
Okay, so you just told us about a lot of different conditions. Will they always be marked by pain?
Well, that's a great question. So chronic pelvic pain is defined by the length of time, lasting at least 6 months. But there are usually other symptoms that may be involved, such as bloating, pain during or around your period, pain during or after intercourse, also pain and pressure when you urinate or have a bowel movement. Even things like infertility and low back pain can be signs of chronic pelvic pain.
Okay, and let's say we're experiencing some of those. What can we do about pain?
Well, the most important thing, Belinda, is don't ignore it. Go get it checked out. See your OBGYN or your healthcare provider. Let them know what your symptoms are and let them help you investigate the cause and determine what the next steps can be. It's important to know that there are treatment options available for many of the things that I just talked about.
And then let's say there were a woman in pain who's listening to this right now. Do you have a final message?
Yes. So HCA Midwest offers access to experts in the field of urogynecology, which is a doctor who specializes in both urology and gynecology. And they also have treatment options available like physical therapy and even minimally invasive robotic surgeries that can help with pelvic or bladder issues.
Dr. Hailey, thank you so much. If you need help finding a provider or an OBGYN physician, go to hcamidwest.com and click on a doctor, or visit hcamidwest.com/women's for more information on women's health.